Members' motion with no legislative effect. Members who wish to speak, please press the Request to Speak button. The Council will proceed to a debate on Mr. Tam Chun-kwok's motion on accelerating the planning and establishment of the New Territories North Hospital Cluster and promoting healthcare developments in New Territories North. Two members will move amendments to the motion. This Council will proceed to a joint debate on the motion and the amendments. I will first call upon Mr. Tam Chun-kwok to speak and move the motion. Then I will call upon Mr. Mark Chong and Mr. Holden CHOW to speak in sequence, but they may not move the amendments at this stage. The joint debate now begins. I now call upon Mr. Tam Chun-kwok to speak and move the motion. Thank you, President. I move that the motion as printed on the agenda be passed. Every time I visit my constituents, there are a lot of views from the residents complaining the long waiting time in public hospitals. Now, residents in NT North has to wait a long time to get an appointment, not to mention the long traveling time. They often need to cross the district to attend a consultation. Now, my motion is to make early planning for the hospital cluster according to the population changes in the New Territories North and shorten the waiting time and address the healthcare difficulties of residents while allocating resources more reasonably. Now, there's Tin Shui Wai Hospital, North District Hospital, and Pok Hoi Hospital in the NT North. There are two clusters in the New Territories, but there's no obstetrician, cardiothoracic specialty, as well as neonatal specialty. Many patients have to cross to other districts to attend consultation. That's also the case for elderly patients. It's a heavy burden for the patients and the carers. The government has been saying that the New Territories North cluster would be added in due course. I think it is not the time. Now, Choi Sek Estate in Shanshui has been receiving population intake, and Fung Wong Estate and Kutong North Estate will also take in population as well. By 2031, the two clusters in New Territories will have a catchment population of 1.3 to 4 million people. Now, with the accelerated development of the Northern Metropolis, the population growth will be more rapid. Now, the delineation of New Territories East and West clusters have been in use for 25 years. It has not been adjusted, even though population has increased. Now, the reasonable catchment size should be 1 to 1.5 million people, so as to maximize the use of resources. We can foresee that the population in the two clusters in the New Territories will meet the upper threshold soon. Without early planning, the burden will increase and the waiting time will be lengthened. And many of the new population will be young people and young families. Without an obstetrics department, the needs will not be met. Now, there will be a new flagship hospital in Yaotang Mei and a hospital in Hong Shui Kiu. If these two hospitals can form a cluster with Pok Hoi Hospital, North District Hospital, and Kutong North Hospital, we can reorganize and rationalize the resources for the New Territories clusters. This will allow us to better utilize the medical talents and resources in the area, so that New Territories North residents can receive a continuum of services within the cluster. They will also see shorter waiting time for specialist services. To add a new cluster takes time. Organization is needed. We need an executive framework as well as rationalizing of manpower. We must be forward-looking, and the timetable must tie in with the development of the Northern Metropolis. We need to start now. With the full development of the Northern Metropolis, there will be 2.5 million people living in the area. That's a large community. Besides public hospitals, other healthcare facilities are also important. Now, a site has been reserved in Kutong North for medical facility development. Planning should be conducted soon to decide its use. Or develop a public-private partnership hospital to divert the stress on the public healthcare system. We should take care of the grassroots as well as the underprivileged. Now, concerning 17 Technopole, a 2-hectare large site has been reserved to build medical facility. We can consider building a private hospital there. Now, the entire New Territories only has 3 private hospitals: Kwong Hospital in Chunwan, Yan'an Hospital in Taiwan, and the Chinese University Hospital. Now, if we can make the best use of these available sites while coordinating the primary resources, we can form a framework where the public and private sector complement each other while driving the growth of the medical industry. Now, on that point, the Northern Metropolis has a very unique mission. In the government's 5-year plan, the Northern Metropolis is the key hub for R&D development and the university town. Medical device and drugs innovation is crucial. Combining the university town and the R&D hub, we can direct the developments of the New Territories North cluster to achieve the dual engine of medical and innovation. Now, the new hospital will be adjacent to the Ho-tau Loop and the 3rd Medical School. On top of providing medical services to the public, these hospitals will be able to provide a large amount of clinical data to promote collaborative growth of research, industry, and academic, and help commercialize innovation outcomes. It can be a nurturing base for life and health technology and talents. It can also be a demonstration zone for medical innovation. There can be synergy with Shenzhen and Ho-tau. There can be cross-boundary medical collaboration and further enhancing Hong Kong's position in terms of life and health technology in the Bay Area. Now, half a year on, this Legislative Council has often discussed how we can empower the developments of Northern Metropolis. Now, the ultimate goal is to make people's life better, and medical services are crucial to living standard. Now, let's support the developments of the New Territories North cluster. Let's make the system a people-oriented, healthcare-first, and innovation-driven system. Let's use medical innovation to drive the developments of the industry so that we can align with the 15th Five-Year Plan and promote innovation in life and health technologies and drugs. I urge members to support my motion. I look forward to hearing your views. Thank you.
I now propose the question to you that the motion moved by Mr. Tam Chun-kwok be passed. Mr. Zhang Ho-fung. Thank you, Mr. Deputy. Before I speak in support of Mr. Tam Chun-kwok's motion to promote the medical development in NT North, and also I am in support of Mr. Holden Chow's amendment. Well, conventionally, the public hospital system has been in tight supply, and to resolve this deep-rooted problem, we need to have a long-term solution, and the most effective way is to have the 3rd medical school here. Well, both within this council and outside, we have been advocating this, and ultimately in 2024, it's announced that in Ngau Tam Mei in the Northern Metropolis, a site will be reserved for the construction of the new hospital and also the research hospital, research and teaching hospital there, and that's to cope with the population growth and also development in NT North. And when necessary, the North District cluster will also be set up, and these services will also be enhanced, and that is also giving a line of light to the residents in NT North. But then when it comes to the details, we have to make sure that people-oriented approach will be adopted. First, on Ngau Tam Mei Hospital and also the research and teaching hospital there. Right now, well, the nearby hospitals include Tim Lun Hospital, Pok Oi Hospital, Tin Shui Wai Hospital, and also the North District Hospital. All of them are very congested, and we urgently need a new hospital to serve the new population, and the Ngau Tam Mei Hospital is right in the center of the Northern Metropolis. We fully support that. But then the most important thing is that is over 10 minutes walk from the Ngau Tam Mei station in the new railway network, and as a result of that, tens of thousands of those who would need to go to the hospital, including the patients, doctors, staff, and so on, they will have to commute between the railway station and the hospital, and it would take more than 20 minutes. And taking the Prince of Wales Hospital, well, it's built right next to the railway station, and it's just a walk of a few minutes. But then Ngo Tam May Hospital has been designated as a research and teaching hospital, and it's also going to tie in with the development of the Santin Technopole as well as the Loop. Well, this hospital is not just a hospital. Top talents on life and health technology industries will be gathered there, and that would also be aligned with future Shenzhen development. A lot of top medical talents will be there, and therefore we urge the administration to review the Ngo Tam May land planning. Well, for the base for clinical teaching and scientific research, it has to be centrally located in order to make sure that it's accessible. And the motion also says that we will have to expedite planning for the North District cluster, because right now the NT-West and NT-East clusters are very big, and also Tuen Mun and Yuen Long already have more than 1.1 million people. And we will have to rely on Tuen Mun Hospital and Pok Hoi Hospital, and these two hospitals have been overloaded for a long time, and every year when there is a peak of, when there is a flu season, they will have to wait for 5 to 8 hours at the emergency at the A&E department. And for new patients, the two hospitals are also overloaded. If you look at the website for ENT and also GNO and also orthopedics and so on, the longest waiting time would be up to 50 to 60 weeks. And then for ophthalmology, it can also be up to 80 weeks. So with new population moving in, and NT-North population will be seeing an explosive growth, and therefore the administration has to make it clear that the timetable for new hospitals, including North District Hospital and also the Ngo Tam May flagship hospital, they will have to be singled out, and they will have to be turned into the NT-North cluster, so that for NT-East and NT-West, they will be able to share the load of these two clusters. And also we will also have to ensure that there would be sufficient manpower to man the hospital, because healthcare elite, very often they would live in the urban area, and for them to commute to Tuen Mun, Yuen Long, and NT-North, the commuting time would already used up a lot of their energy, and therefore the administration will have to provide appropriate resources, so that for those who have to cross districts to work, they will have to be given more support, so as to ensure more people would be willing to go to the remote NT-North Hospital cluster to help. Your time's up. Mr. Holden CHOW. Mr. Deputy, first of all, I'd like to thank Mr. Tam Chun-kwok for moving this motion. Well, this has to do with people's livelihood. Everybody's well-being is something that we are very concerned. NT-North population is growing, and therefore there is a need for the administration to develop medical services there, and also we will also have to enhance primary care. We absolutely agree. Well, in Ngo Tam May, some 9 hectares of land will be set aside for a clinical research and scientific research hospital. I have to declare that I am a member of the council of the HKUST, and the HKUST will be building the 3rd medical school in Hong Kong, and of course that would be good for the entire territory. But then I have to point out that in the motion, it has been pointed out that in planning for the NT-North cluster, there are several things that we need to pay attention to. First, Mr. Deputy, well, in Ngo Tam May, before the hospital is completed, if we were to increase the NT-North cluster, then there are several things that we need to note. That is, some of those who are living in Yuen Long, Tin Shui Wai might be inconvenienced, because as you know, many Yuen Long Tin Shui Wai residents would go to Tuen Mun Hospital for consultation, because Tuen Mun Hospital is a general hospital. And taking GNO as an example, Pok Hoi Hospital, Tin Shui Wai Hospital do not have such services. So you can imagine, for pregnant women, they can only go to that hospital for consultation and care. And therefore, if it's listed as the NT-North cluster, then for those living in Yuen Long Tin Shui Wai, they will no longer be able to go to Tuen Mun Hospital as they used to, because if they had to cross district, then they will have to have a referral from the doctors, and additional procedures might be required, and as a result, they would have to spend more time and efforts before they can get the service. Secondly, we would also like to point out that right now what we have seen is that in NT West, there are 5 hospitals. And in fact, Tin Shui Wai Hospital and Pok Oi Hospital, in the event that they are classified as NT North Hospital, then there will only be Tuen Mun Hospital left as a general hospital. And given the situation, sometimes we can see that when we need to triage some of the patients to different hospitals. In fact, Tuen Mun Hospital right now, the medicine department or ward sometimes is so saturated that the occupation rate is more than 100%. And in the future, if it's to be put under the NT North cluster, then how are we going to triage patients to that hospital? That's something to be considered. And in dealing with a new hospital like Ngo Tham Mae Hospital, upon its commissioning, if there's to be new classification, I think that would be somewhat better. So in the amendment, what I'd like to point out is that in dealing with the relationship between clusters, we will have to consider that between different districts, a balance needs to be struck in terms of resources and manpower in order to take care of the needs of the individual districts. In the past, the DAB's teams have been taking care of NT West. We hope that more private hospitals can be put in place. And of course, Ngo Tham Mae is going to see a new hospital. But then if there are other private hospitals that can be located in NT Northwest, then they would also be able to serve as a triage points for patients. And of course, Mr. Chong Ho-fung has also moved his amendment. We believe that for cross-cluster resources redeployment, so that resources and manpower can go elsewhere to serve the patients. But then how broad should the line be drawn? Would that mean that every cluster will be doing the same? And if that is the case, then what about the expansion of public resources? Will that be the case? That's something that we will have to consider. So in our later discussion, I'm sure more comments will be made about this. All in all, I believe that in the adjustment of resources for different clusters, we have to make sure that they are used effectively in the end. We have to make sure that we can take care of the needs of different districts, including those living in NT Northwest, including those in Tuen Mun. These are my remarks.
Secretary for Health. Deputy President, I would like to thank Mr. Tam Chun-kwok for proposing the motion accelerating the planning and establishment of the New Territories North Hospital Cluster and promoting healthcare development in New Territories North. To actively align with the National 15 5-year plan, the Hong Kong SAR has plans to, for the first time, draw up its own 5-year plan and launch a public consultation last week. Accelerating the development of the Northern Metropolis is an important part of the plan, making today's motion debate particularly timely. The Hospital Authority adopts a cluster-based approach in the planning and development of public health care services. Through coordination amongst hospitals within each cluster, it is convenient for patients to receive continuous, appropriate, and high-quality services within the same geographical area. The HA closely monitors and responds to changes in service demand resulting from projected population growth, distribution, and demographic changes when carrying out cluster planning. In this process, the HA also takes into account the latest models of healthcare service delivery. The new territories are currently divided into 2 clusters, New Territories West and New Territories East. With the development of the Northern Metropolis pressing ahead at full steam, we would see the population of the new territories rise significantly. The projected population growth in the North District and Yuen Long District is expected to be significant. According to the latest projections of population distribution, between 2021 and 2031, the population of Yuen Long is projected to increase from approximately 668,000 to approximately 761,000, whilst that of North District is projected to rise from approximately 310,000 to approximately 436,000, representing increases of approximately 13.8% and 40.7% respectively. Population growth in these two districts is expected to become even more pronounced after 2031 with the completion of development projects in the new development areas. Based on past experience, a cluster covering a population of approximately 1 million to 1.5 million enables more effective service coordination and the achievement of economies of scale. Therefore, the conditions for establishing the new Territories North cluster are expected to be even more favorable then. To capitalize on these planning opportunities, the Hospital Authority is comprehensively reviewing Hong Kong 2030 Plus towards a planning vision and strategy transcending 2030 and the construction progress of new development areas. It is closely monitoring future population growth and changes in distribution and structure of the population across various regions of the new territories also. The Hospital Authority commenced planning for the new territories clinical services plan in Q2 of this year. The first phase focuses on service planning for the new territories North cluster, including exploring the timing for establishing the new cluster and the roles of scope of services of various hospitals in the cluster. The new territories clinical services plan will form the foundation of long-term plans and adjustments in the configuration of cluster services, including assessing the need for and feasibility of constructing a hospital in Hongshou-Q. I am now going to briefly outline the government-specific measures to promote healthcare development in New Territories North, focusing on 5 key areas: healthcare resource planning, the establishment of a medical school, the involvement of the private healthcare sector, the development of primary healthcare, and innovation in medical research and development. For healthcare resource planning, to meet the projected service demand, the government is systematically advancing the infrastructural development of healthcare facilities in New Territories North through the Hospital Development Plan. The projects in New Territories North include the completed North District Parkwell Road Family Medicine Integrated Center cum social welfare facilities and the expansion project for the North District Hospital. The main works commence in September 2024 for the North District Hospital expansion project. It is expected to be commissioned in phases from 2029, with the entire project due for completion in 2031. The North District Hospital, upon expansion, will provide an additional 1,500 beds, strengthening its role as the district's acute general hospital. Residents of New Territories North will benefit from the improvement in quality with the expansion of the North District Hospital in the near future. In the light of changes in Hong Kong's demographic structure, the Bureau and the HA are currently reviewing the scale and priorities of the second hospital development plan, including how to strengthen existing healthcare services in Yuen Long and Tin Shui Wai, and providing healthcare coverage for new development areas such as Hongshou-Q and Tam Chun-kwok. The Hospital Authority observed that the area of land reserved for medical facilities in the Chong North New Development area is relatively small, and there are geographical constraints that prevent the site from being expanded. The Bureau has identified, therefore, an alternative site for medical facilities in Tam Chun-kwok. The new site is more than twice the size of Chong North site and is adjacent to the site reserved for the 3rd medical school campus and the development of an integrated hospital for medical teaching and research purposes. And the hospital will provide 1,100 beds in the first phase and 1,300 additional beds in the second phase. The 3rd medical school will also serve as a clinical teaching and training platform for undergraduate students of the medical school. With the establishment of the third medical school, it responds to the needs of an aging population and a shortage of healthcare personnel. Hosted by the HKUST Hong Kong University of Science and Technology, the third medical school aims to enroll its first cohort of 50 students in the 2028-29 academic year. The new medical school will focus on cultivating talent with both clinical and research capabilities, while attracting more medical professionals to take up teaching and research work. We are planning to adopt an integrated planning and design approach to jointly advance with the UST the integrated development of the new medical school's permanent campus in Altamae and the Altamae Integrated Medical Teaching and Research Hospital. We fully support the early commencement of the relevant construction project. To have a higher degree of private sector participation in the Santon Technopole, a site of approximately 2 hectares has been set aside for the construction of healthcare facilities. The government is pressing ahead with the development of Santon Technopole in 2 phases, with the reserve site included in the second phase development. The CEDD commenced works for the first phase development at the end of 2024 and began detailed design work for the second phase development in early 2025, with site formation and infrastructure works to follow in an orderly manner. The Health Bureau will continue to liaise closely with relevant policy bureaus and departments to take into account various factors such as progress of land resumption and site formation works, as well as market response, in drawing up a timetable for development of the reserve site in a timely manner, whilst exploring actively suitable service delivery models for the proposed healthcare facilities. In terms of primary health care, the government has already established a district health center in Yuen Long and a district health center express in the North District. In Yuen Long, in addition to the main center, there are 4 satellite centers and 3 service points. In North District, in addition to the main center, there are 4 service points. Construction work on North District DHC is currently underway and is expected to be completed by the end of 2029. DHCs act as hubs in primary health care. Through these centers, the Primary Healthcare Commission will coordinate multidisciplinary primary healthcare teams centered around family doctors to provide appropriate health management advice and support based on the public's health and needs. Meanwhile, the government is further promoting the matching of members of the public with family doctors through the Primary Healthcare Co-Care Network. To assist members of the public in selecting suitable primary healthcare service providers, the government published the Primary Healthcare Directory, providing easy access of information for members of the public. Currently, the Primary Healthcare Directory lists approximately 300 Western medicine practices located in Yuen Long and North District. As regards family medicine clinics, the Hospital Authority currently operates 4 such clinics in the North District. The North District Family Medicine Integrated Center in particular commenced operations at the end of 2024. The Hospital Authority also plans to establish an additional family medicine clinic within the Kutong North Joint User Complex. There are 5 family medicine clinics in Yuen Long, 2 of which provide evening outpatient services, whilst 1 offers outpatient services on Sundays and public holidays. The HA and the Primary Healthcare Commission will closely monitor the operations and service utilization of family medicine clinics and flexibly allocate staff and other resources to provide appropriate primary healthcare services to residents of New Territories North. The development of healthcare in New Territories North is not limited to increasing the number of hospital beds and primary healthcare facilities. It also involves seizing the development opportunities presented by the Northern Metropolis to establish an innovation innovation-driven ecosystem for the life and health technology industry. The GBA International Clinical Trial Institute, established and wholly owned by the Hong Kong SAR government, has officially opened in the Hong Kong Park of the Loop. Established in tandem with the GBA International Clinical Trial Center in Shenzhen Park, this One Institute, One Center model has become a benchmark for the coordinated development of the One Zone, Two Parks initiative. And we have also established the Real World Study and Application Center and launched the GBA Clinical Trial Collaboration Platform to coordinate the conduct of multi-center cross-border clinical trials. Since the commissioning of the Real World Center, it has facilitated 10 clinical trials and real-world studies. It has signed memoranda of understanding with pharmaceutical companies such as GSK and Immunocare Biotech to jointly promote clinical trials, real-world data research, and talent development in the GBA. The Hong Kong Park in the Loop also has a clear positioning on the development of life and health technology, adopting an industry-led model. The park prioritizes cutting-edge fields. As of May 2026, the park's first 2 wet lab buildings had attracted more than 90 enterprises from Hong Kong, the mainland, and overseas, with those involved in life and health technology accounting for approximately 40% of the total number of enterprises. We are making use of the One Institute, One Center model to build the clinical collaboration platform, and the Hong Kong Park of the Loop will promote INT development related to life and health technology. It can foster a comprehensive ecosystem. The Centrum Technopole serves as a natural extension of the Hong Kong Park in the Loop, facilitating the commercialization and industrialization of R&D outcomes, forming a comprehensive industrial ecosystem. The Altamae University Town is home to the 3rd Medical School and is adjacent to the Centrum Technopole and the Loop, and it can serve as a vital platform for innovative development of advanced industries. The Loop, Centrum, and Altamae will collectively form a development base for life and health technology. Deputy President, the Northern Metropolis is a new engine for Hong Kong's development, and a comprehensive network of district health resources will not only provide necessary support for the Northern Metropolis and help develop new quality productive forces. I am more than willing to listen to members' views in due course. Thank you. Mr. Chan Pok Chi.
Mr. Chan Pok Chi. Well, I thank Mr. Tam for moving the motion. Well, the Northern Metropolis and also the population in NT North have been growing very rapidly, and therefore to implement the NT North hospital clusters planning is very important, because we have a modernized society, and we also have to modernize our healthcare services. This is a people's livelihoods project, and that is also the core for the future long-term development of the district. The district is very fast and is also very remote from the urban area, and therefore the commuting cost will be higher. And therefore, for frontline staff, the supply has been very tight, and as a result, for a long time, services have been inadequate and waiting time is long, and therefore we will have to provide more incentives so that the clusters services will be more competitive and we can retain talents, and we will also be able to build up a stable healthcare services team, and that's the route to easing the pressure, and that would also ensure that the NT North cluster can provide services steadily. And in terms of providing convenience to the public, we will also have to provide more night consultation, and we should also have a round-the-clock consultation hotline set up to meet the needs of NT North residents, because for the evening clinics, the quota is not enough, and during holidays, the supply is even tighter, and very often they can only go to the A&E department of public hospitals, and with a mismatch in demand and supply, the situation is even worse, and therefore we will have to increase the quota for evening clinic or consultation, and that would also help triage the demand for emergency services, so that we can provide all weather and also necessary services to the public, so that they don't have to go to remote areas for consultation, and that would also enhance the coverage and convenience for residents. And also, we would also have to enhance the chronic disease screening system. And then traditional Chinese medicine should also be included under the chronic disease co-care pilot scheme, so that prevention is better than cure approach will be adopted for that. What with continuous increase in population in NT-North, diabetes and also hypertension patients are growing in number, and therefore we will have to have better management for these patients, and introducing TCM care for them would also provide all-cycle community care service for them, and that would also ensure that healthcare services will become more proactive instead of providing just passive services, and that could also help ease the load for the public healthcare system. And in the long run, NT-North Hospital Cluster is not just to serve people's livelihood, but also a base for developing life healthcare and also promoting clinical teaching and scientific researchers. Well, we should consolidate the public hospitals' resources within the district, and we will also be building the flagship hospital in Ngau Tam Mei, and also Tin Shui Wai Hospital should also be expanded, and also the Santin Technopole and also the Loop Life Health Technology industry can also be developed. With the new cluster, we will be able to redeploy the resources, and we will also be upgrading the services to ensure that both research and teaching and they can also be integrated into one whole project. While people's livelihood and well-being is the cornerstone of a society that can also enhance our competitiveness, I earnestly urge that you would accept the DAB's proposal, so that you can make a decision on the consolidated management of the NT-North cluster. And we should also have a timetable for the expansion program for hospitals. We should also provide more incentives to attract talents, and there should also be better public-private sector collaboration, so that NT-North residents will be able to receive quality services, and they should be more convenient, and there should also be better matching of services and residents' needs in order to ensure that there would be stable development in the future. Thank you.
Mr. Lau Kang-keung. Deputy President, I thank Mr. Tam Chun-kwok for his motion and the amendments from the two members. The first Hong Kong 5-year plan's consultation paper has put the acceleration of development of the Northern Metropolis in the first chapter. It highlights the importance of the area. After fully developed, it will have a population of 2.5 million. There will be keen demand for healthcare services. We need to make advanced planning to ensure that the supply of healthcare services can tie in with the population growth, so as to lay a solid foundation for the development of the Northern Metropolis. I have two suggestions. First, tying in with the North Metropolis developments and speed up the developments of the New Territories North Cluster. Now, according to the 2025 Hospital Clustering Plan of the Hospital Authority, there is a plan to add the New Territories North Cluster, as well as adjusting the coverage area of the New Territories East Cluster. Now, Tin Shui Wai Hospital and Pok Hoi Hospital belong to the New Territories West Cluster. There should be a unified management system for the hospitals in the Northern Metropolis, so as to rationalize the allocation of manpower resources as well as specialist service resources. Now, as the Integrated Medical Teaching and Research Hospital, the hospital in Ngau Tam Mei can tie in with the developments of life and health technology in Santin Technopole to enhance collaboration between the research and industry. This is in alignment with the direction of high-quality development, as well as creating a platform for high-quality talents. Now, the government should set a timetable for expanding the Tin Shui Wai Hospital and completing the Hung Shih-Kyaw Hospital to increase the supply of healthcare services in the New Territories. Second, we need to allocate specialist resources flexibly according to the population. Now, by 2031, there will be a continuous drop in population in the island area. There will be 640,000 and 480,000 people in the two clusters on the Hong Kong island. Now, in Eastern, elderly people accounts for 27.1% of the population, the highest in the territory. There's great demand for geriatric services, while the New Territories North District will be the youngest district in Hong Kong with greater demand for pediatrics and obstetric services. Now, we should make advanced planning based on these demographic changes. For example, we should focus on geriatrics and rehabilitation services for the elderly in Hong Kong Island, and while we can add more pediatricians and youth services in new territories, this can ensure that the patient's needs are met. Third, we have to enhance the community healthcare network and expand the coverage of primary healthcare. New Territories North is a vast area. The journey time for some patients is long. That's why I support Mr. Kasaf Tam's suggestion to expand community health center services and also ensuring that there are greater supply of family doctors. We should also step up implementation of the chronic disease co-care scheme to forge a people-oriented and healthcare-first system. I so submit. Mr. Brave Chen. Thank you, Deputy President. I also thank Professor Low. I thank Mr. Kasaf Tam for his motion and the amendments concerning accelerating the planning and establishment of the New Territories North Hospital Cluster and promoting healthcare developments there. I would like to add to the motion by proposing to develop a modernized healthcare system in Hong Kong. Both the central governments and the Hong Kong SL governments have attached importance to building a modernized healthcare system. President Xi mentioned that the country must enhance its public healthcare system and attach strategic importance to people's health. The National 15th Five-Year Plan stipulates that building a high-quality and highly efficient healthcare system with the assistance of digital technology to enhance primary healthcare capacity is crucial to enhancing people's well-being. I think healthcare should be given the top priority. As mentioned by the Chief Executive, we need to deepen the reform of our healthcare system, enhancing its sustainability, enhancing primary healthcare, and actively aligning with the National 15th Five-Year Plan to build Hong Kong into an international medical innovation hub. Now, the Northern Metropolis will be the geo engine for growth, that is our international financial center status and international innovation center. It will be a base for medical innovation. Now, the consultation paper for Hong Kong's 5-year plan has been published last week. The Northern Metropolis is on top of the agenda. Now, as a member serving the New Territories constituency, I am in close touch with the community bodies there. The medical resources in the New Territories clusters are insufficient compared with the Kowloon clusters. While the New Territories has a larger population and enjoys closer proximity with the Bay Area. Now, in terms of Central Technopole and the Hong Kong Park in the Loop, there will be a focus on developing life and health technologies. The Chief Executive and Professor Lau have reserved a site in Yau Tam Mei to build an integrated hospital and also a third medical school. Now, this has given us much hope concerning the development of the medical facilities in the area surrounding the New Territories North area. The New Territories North residents have high hopes for these measures. So we need to accelerate the collaborative developments between research, academics, and industry. By adding a new cluster, we can enhance the synergy between the three and make it one of the world-leading medical hubs. Now, also, we need to enhance the primary healthcare coverage rate in the area. Now, according to a DAB survey, more than 60% of the respondents are of the view that there are insufficient medical facilities in the New Territories North area. I know the government is making plans to enhance the service. There should be more evening clinics and 24-hour acute services. Overall speaking, we need to accelerate the development of the New Territories North modernized medical cluster, riding on the opportunities of the Northern Metropolis. We need to add this into our 5-year plan to make Hong Kong an international medical innovation hub. That will benefit the public and also provide hope for our future development. Mr. Jonathan Leung, Deputy President, after the full development of the Northern Metropolis, there will be 2.5 million population in the area, accounting for 1/3 of the total population. And with the population surge, the Liberal Party suggests the government making early plans for its medical service. Now, the government is now in full steam in enhancing the medical network in the area, while preparing for the construction of the 3rd medical school as well as the integrated medical teaching and research hospital in Yau Tam Mei. There will be 3,000 additional beds. These beds will be commissioned in batches by 2028 and 9, while the North District Hospital has commenced its expansion project by the end of 2024, which will be completed in 2028. The number of beds will be increased from 600 to 2,100. Concerning expanding the Tin Shui Hospital, building the Hong Shui Kiu Hospital, and the Sentin Tenopol Private Hospital, if there is greater demand for these services, the Liberal Party does not object, but we are concerned about the availability of medical manpower. Even with sufficient hardware, without a team of experts, the public cannot enjoy high-quality medical services. Now, with the aging population in Hong Kong, the shortage in medical manpower has been exacerbated. Now, by 2030, there will be 8,700 shortage of nurses and some 7,000 shortage in doctor. Now, for every 1,000 population, there will only be 2 doctors, much lower than those in Japan, Singapore, and other countries. Now, we are lagging far behind other advanced economies. Concerning the shortage in medical manpower, the Liberal Party has been urging for the government to introduce non-locally trained doctors, including providing a special pathway for limited registration for doctors trained in other famous universities. Now, the HA has been launching measures to retain talents. Now, there are 7,400 and 30,500 doctors and nurses in the hospital, and there are more than 300 non-locally trained doctors and nurses working in our hospitals. The wastage rate has stabilized. However, we need to increase the supply of talents to meet the increasing demand. And concerning providing additional allowances to medical personnel working across the district to lure them to work in the Northern Metropolis, the Liberal Party considers that lucrative to some medical personnel, but the long-term solution should be providing accommodation for these medical personnel in the area. Otherwise, there will be competition for talents between the clusters. In the end, it would destabilize the healthcare system in Hong Kong. So we must ensure that there is an abundant supply of medical personnel in Hong Kong. The HA should adopt multi-pronged approach, including enhancing the quota places for medical students and also attract more qualified non-locally trained doctors through the special pathway, as well as providing flexible working hours to attract retired healthcare professionals to return to the workplace, and also reducing the administrative burden for frontline doctors and nurses. Now, the development of hardware must be aligned with the nurturing of talents to ensure that patients are adequately cared for. Let's make the Northern Metropolis a livable area for growth. I support the motion and amendment.
Mr. Albert Chung. Thank you, Deputy President. I would like to thank Mr. Tam Chun-kwok for proposing the original motion. He has proposed 7 specific measures for the development of healthcare in New Territories North. The HA anticipated last year there will be a significant increase in population in New Territories East and West. And in response to development of the Northern Metropolis, the Northern New Territories North cluster is to be established. In fact, with Director Xia Baolong's visit last week, he also visited the proposed site in the Northern Metropolis. The North District Hospital provides 110,000 diagnostic treatments as well as other services. I think it definitely there's a need to enhance the capabilities of New Territories. I would like to propose some suggestions for the development of biomedicine. The loop has an advantage of one so two parks to focus on R&D of biomed technologies and transformation of R&D outcomes. The government should act in tandem with developments in the industry and make advanced plans for the construction of biotech clusters. In fact, in the US, they have similar clusters, and they have operations from Harvard University, MIT, top-notch universities. They have an anchoring model where it would drive upstream and downstream operations. In Hong Kong, we have introduced Pfizer, Atlantic, 5 of the 10 top pharmaceutical companies. We also have some top-notch pharmaceutical companies from the mainland. And we have ancillary facilities, that is a flagship hospital as well as Center Technopole. The government should work with interdepartmental coordination to foster a cluster that complies with GMPs and would act as a base for pilot production and transformation of biotech research and development outcomes. We have the GBA International Clinical Trial Institute that is not impeded by restrictions of cross-boundary data flow. We have a large population in the mainland, and with flow of standardized healthcare data with the mainland in compliance with relevant standards, we can really do much in research, and we need to make sure to enhance computing power of AI healthcare with that. we need to make sure we have full coverage of different data input to ensure we facilitate the smooth flow of the different factor input across boundaries. We need to cultivate cross-disciplinary talent for biotech as well. We have the MIT providing cross-disciplinary degree programs that would cover both biotech and commerce. And over 90% of the tuition fees are paid for by, for example, AstraZeneca. We have the new medical school to be housed in Tam, and they said specifically, the university said specifically, they would practice a cluster-plenary model. We should make sure to have industry participation and outside experts for the university to coordinate the cooperation between the industry, academia, and research sector. I so submit speaking in support of the original motion. Ms. Jenny Man, Deputy President, I speak in support of the original motion. The National 15 Five-Year Plan explicitly supports Hong Kong in developing biotech, and in fact, a comprehensive healthcare system is definitely necessary for retaining talent in the northern metropolis. We want to provide care within the same geographical area, and if different hospitals form a cluster, it will be more flexible in allocating administrative resources and personnel. We have good allocation in Hong Kong Island and Kowloon, but then for the new territories, because it is expensive, it is very hard to only rely on the two existing clusters. We also need to take into account the growing population. The first batch of public housing units in the northern metropolis would include those in Kutong North and Fanling North, 8,000 units in total. We will see the first batch of population intake by the end of this year. In the next 5 years, we will have public housing units reaching 70,000, but we only provide 3,000 beds. We don't even have a clear timetable for providing such beds. That is less than ideal. With the development of Northern Metropolis, we want to practice an infrastructure-led approach. We are doing much in putting in place transportation infrastructure, but healthcare infrastructure is lagging behind. I therefore support what is said in the original motion to have a clear timetable and expedite relevant construction so that those who are going to move into Northern Metropolis can rest assured. We should also develop private sector healthcare in New Territories North. We should make good use of the forces of civil society organizations as well as charitable organizations. We need to invest more heavily in primary healthcare. And the private sector healthcare is playing an indispensable part in the local healthcare system. Perhaps we can work with charitable organizations to provide healthcare facilities in the northern metropolis. It doesn't have to be a hospital. It can just be a district health center or a Chinese medicine clinic. We can also rely on charitable organizations that have experience in operating hospitals to provide more healthcare facilities in the northern metropolis. We should also make good use of the geographical location of the northern metropolis. We have many Hong Kongers living on the mainland but would still seek treatment and other services in Hong Kong. Since New Territories North is close to Shenzhen, for those living in the mainland, they can take advantage of the services in the New Territories North cluster, providing convenience to them. Many citizens consider different factors when they consider whether to move to Northern Metropolis. We need to also make sure on top of facilities we have adequate healthcare personnel. Some may have to work across different districts. We need to consider that to have a comprehensive healthcare system. I so submit Professor Alex Fan. Deputy President, I speak in support of the motion. With continuous growth of the population in the Northern Metropolis, there is pressing need for construction and planning of healthcare facilities in the area. I want to take a more macro perspective in expressing my views. I think first we need to focus on quality and emergency response capabilities. We need to ensure the quality of facilities, not just quantity. From 2019 to 2022, with the COVID-19 pandemic, it really exposed the vulnerabilities of the public healthcare system in the city. We have beds that are filled, and we needed temporary isolation facilities. If the New Territories North cluster's construction neglects the emergency scenarios, for example, large-scale pandemics or other forms of emergencies, we may see what happened before happened again. So when planning for the New Territories North cluster, I urge the government to be accommodating of different scenarios. We need to be flexible. We need to have wards that can be quickly converted. We need to have independent ventilation and isolation systems. I think we can really take this opportunity to practice a forward-looking approach to make sure we account for more than routine needs. I think we should also tap into the strategic opportunities of cross-boundary medical integration. We need to make good use of Central Technopole and the Loop to develop life and health technology industry, as said in the motion. I want to supplement with some of my observations. The Northern Metropolis is close to Shenzhen. It is naturally favorable to have different pilot arrangements. We already have some pilot arrangements for cross-boundary health infrastructure, but it is limited in scope. We need to have a systematic framework. The New Territories North cluster can be a platform for institutionalization of different arrangements. For example, cross-boundary health record sharing, as well as mutual recognition of healthcare qualifications, so that the Northern Metropolis can be an important node of medical integration in the Greater Bay Area. We also need to make sure there is good data flow, because that determines the quality of medical services. In 2024, the government received funding from LegCo to implement a 5-year plan for e-health. We still have limited private sector participation in the initiative. So health records of patients in the private sector are not shared. I propose that the administration link the private sector promotion of e-health with the development timetable of Northern Metropolis, so that there is in tandem development with the development of Northern Metropolis. The e-health related legislation came into operation last year, so we now have the legal foundations to form a comprehensive governance framework. I urge the government to expedite the promulgation of relevant framework, and we can make use of New Territories North cluster as a pilot demonstration zone. It is an important initiative of the current term government to develop the Northern Metropolis. And when we are drafting the 5-year plan, we need to make sure to have in mind a macro mindset on how we are developing medical facilities. I submit.
Mr. Duncan Chiu, I have to declare interest because I'm the governance committee of both Princess Margaret Hospital and also another hospital. I speak in support of both the original motion and the amendments. Well, as far as hospitals are concerned, increasing hospital clusters has always been a subject of discussion. as to whether or not we need to have the NT North cluster, I think the Bureau should look at the facilities, manpower, demand, and also number of hospital beds and so on, so that better consideration can be made. I do not have specific comments on this, but then in NT North, if we were to build a hospital cluster, I hope that the cluster would serve a different meaning, because as the Secretary said, in NT North, we have a lot of important facilities. We have the Loop. We also have Hon TAM Hospital. We are also going to have the 3rd Medical School, and a large number of pharmaceutical companies and also tech companies will also be coming here, and they will also be located. They are also likely to be located in NT North. So how are we going to make sure that the negotiations as well as the collaboration can be matched properly, so that we can also become a healthcare technology center? That's also important. In fact, for medical technology enterprises, there are still some bottlenecks right now, because as the Secretary said, some real-time data and also medical devices scrutiny procedures, they would also have to be enhanced for new drugs. Research and development work, new policies have come into play. But then for clinical research, sample taking, and also some clinical studies, and also expediting new drug development and administration as to medical devices, there are also some scenario researchers, for example, cross-boundary researchers and so on. So we might also come up with templates and also prototypes that are developed cross-boundary. So in terms of the medical teams and also research enterprises, they will have to collaborate in order to ensure that we can become a healthcare innovation center. It's not just about the hospital clustering. We will also need to work with the Education Bureau and also the Office for the introduction of new or the Office for introducing new technologies and so on too, so that they can work together. So for existing services and facilities, they will have to be enhanced and coordinated. And as the chairman of the governance committee for Queen Margaret Hospital and Kwai Chung Hospital, well, in fact, Princess Margaret Hospital has been the leading hospital in Kowloon West that has been in use for over 50 years, and 1,800 hospital beds. The occupation rate is often over 100%. We often have beds in the corridor and so on. I hope that members would also pay attention to that. Well, in 10 years, we will need to increase the number of beds by 3,000, but then in phase 1 for LegCo block is going to be commissioned shortly. 500 additional beds will be commissioned, but then there is still a gap of some 500 beds. I hope that contingency plans can be formulated in order to increase hospital planning. Taking Queen Margaret Hospital as an example, the utilization rate is already overloaded, and the ceiling and also loading are also overloaded. We would like to have some new equipment, but then we can't do it. And even for cancer treatment and also chemotherapy and also endoscopy treatments and so on, all the facilities are inadequate. So even if we were to increase the number of facilities for patients, if there is new space, then that would be better. And also for NT North, as we just said, in the future there will be population growth. Kwai Chung Hospital's recent example shows that for our psychology services, psychiatric services, they are much needed, and therefore we will need to ensure that there would be good planning for this. So that's something to be considered. And just now we said that in 2016, well, in the 10-year hospital building program, that was set out in the policy address. Well, Kwai Chung Hospitals will be commissioned shortly thanks to the support of the government. But then for the other major projects, I hope that under the 10-year plan, they can also be commissioned by phases. We hope that a new timetable can be provided so that for NT West, our capacity can be increased, and that would be the support for us. So these are my remarks in support of the motion. Thank you. Mr. Chen Ming-kwong, thank you. Mr. Deputy, I'd like to thank Mr. Tam Chun-kwok for moving the motion so that for NT North, including the Northern Metropolis and also other areas, we can have a more focused discussion. I support the original motion because we will have to expedite planning to implement the NT North Hospital Cluster proposal. In fact, the policy address already said that we will have to expedite the construction, and Mr. Xia Baolong, the director for the Hong Kong and Macau Affairs Office, and also the the Hong Kong and Macau Affairs Work Office has also said that a couple of days ago, medical services would safeguard the health of the public, and that's also the core of healthcare development. And we are building the Northern Metropolis full steam, and therefore I believe that the planning work for the NTN hospital cluster should also be completed as soon as possible. Because of the population growth and population distribution, we will have to expedite the implementation of the NTN hospital cluster for the well-being of the residents, so that we can lay a solid foundation for that. As to how we can plan for the NTN hospital cluster, the original motion proposes many constructive suggestions, but then if you look at the first item in the original motion, I'd like to point out that at present the NTN hospital clusters has a total of 5 hospitals, including Castle Peak Hospital, Bogoi Hospital, Tin Shui Wai Hospital, and also Tin Mun Hospital, whereas Castle Peak Hospital and Siu Lam Hospital are providing psychiatric services and also rehabilitation services and also maintenance service or rehabilitative services. And therefore, if they were incorporated in the NTN hospital cluster, then the heavy duty of providing services for NT West will then fall upon its shoulders, and therefore I'll be more inclined to supporting Mr. Holden Chow's amendment, so that in planning for the NTN hospital cluster, we would also have to comprehensively consider the distribution of population in NT and also the location of the hospital and also the demand for public hospital services. We should also attach importance to hospitals outside of the cluster, and also in between the different clusters, there should also be better coordination in order to ensure that residents in the clusters can be better served, and there can also be synergy effect that would also help enhance the quality of service in NT North. Well, as public healthcare services have a lot to do with people's well-being, and therefore I suggest that in planning for the NTN hospital cluster, I hope that you would not be doing everything behind closed doors. You should take the initiative to consult the public and take on board their views, so that in the future, the NTN hospital cluster, in terms of the demarcation of services and provision of services, they'll be able to meet the residents' needs. And well, for NT East and NT West hospital clusters, if services have to be adjusted, I hope that you can step up connection with lawmakers and all the stakeholders, so that you would be explaining the policy on the ground, so that the public will know very well as to the healthcare services and resources distribution between the different clusters, so that they would not be affected when they seek medical attention. And also, in developing the NTN hospital cluster, you will also have to fully consult healthcare staff, so as to ensure that resources and manpower would be distributed evenly, so that there would be sufficient manpower to man these clusters. Well, as someone from the Chinese medicine sector, I'd like to say something about the future services in traditional Chinese medicine. Well, in the action plan for the Northern Metropolis, I understand that within the Northern Metropolis, there would be new development areas. Space will be reserved for the setting up of Chinese medicine clinic. Other than TCM clinics, we should also increase these TCM services at the DHCs, the district health centers, so that TCM services will be able to better safeguard the health of the public. On top of that, the NT and the Northern Metropolis would also develop healthcare services, so that we'll be able to build TCM's research center to promote the high quality development of TCM. These are my remarks. Thank you. Mr. Alan Chen. Thank you, Mr. Deputy. Well, the NTN hospital cluster is not just about the development of a single hospital. In fact, it's about whether or not the Northern Metropolis will be able to cope with such developments, because we have 2 hospital clusters, and the NT East will serve Tai Po, Sha Tin, and the other parts of the new territories. And with the development of the Northern Metropolis, the North District and also the other areas will see a population growth. Each cluster would be serving 1 to 1.5 million people, and that's the most ideal arrangement. And projecting into 2035, NT East and NT West clusters will be serving some 1.44 and 1.35 million people respectively. So it's close to 1.5 million people in each district, and therefore the healthcare services will be scattered in NT East and NT West. So I think you will lose the focus, because it's not just about the hardware in terms of hospital. You will also have to look at the manpower resources. According to the statistics of the Hospital Authority, we have 16,533 doctors. In other words, we only have 2.2 doctors per 1,000 population. According to the World Bank's statistics in Singapore in 2022, well, there are some 2.8 doctors per 1,000 population. And in terms of hardware, in terms of the numbers of beds, we have 30,816 beds. In other words, it's 4.1 per 1,000. So even if private hospitals are taken into account, we only have 4.8 beds per 1,000 people. And therefore, the overloading of the system and also the uneven distribution of resources in different clusters, the NT North Hospital cluster should not just be looking at the progress of the works. We should also be looking at the number of healthcare manpower per 1,000 and also the construction of the infrastructure and also the target. I suggest that we should announce the NT North boundaries, the structure, population, as well as the projection in terms of diseases, distribution. And then in the medium to long term, we will also have to come up with a ratio between hospital beds and also specialist services and also manpower targets. Eastern Hospital, Parkway Hospital, and Tin Shui Wai Hospital, and also the Ho Tam General Hospital, which is both a teaching and research hospital. We will have to delineate the responsibilities clearly instead of just developing them separately. For the Hong Kio Hospital that has been proposed, we have seen the progress already. And then for Ho Tam Hospital, that is a research and teaching hospital. That should also tie in with the third medical school. It should be planned together with that in order to ensure that both teaching and research can be done and it can be developed into a Northern Metropolis flagship hospital. But then there is a transition, and therefore we will need to expand the Tin Shui Wai and North District Hospital in order to enhance the daycare as well as the A&E support capabilities. And we will also have to make use of the Gutong North Reserve Site so that they can provide healthcare support and community care and welfare purposes, so that the facilities will not lag behind population intake. And also, community facilities should also be developed. We will have a manpower scheme for NT Northwest. We will have local training, and we will also have to tap into the resources of local institutions. We should also provide training and also boarding for them, and family doctors and also district health centers should be used to extend the hours of consultation and also mobile care and also chronic disease treatment and so on, so that residents can go to their local district for treatment and care. And then the loop and also the Santin Technopole would also develop life and health technology industries, and that should also work with the NT North so that they can have a clinical conversion platform set up. Well, the hospital can be built in a few years, but then in terms of nurturing talents, it would take a long time, and therefore to build up the NTN hospital cluster would lay the foundation for that. I support the original motion as well as all the amendments. Thank you.
Ms. Rebecca Chen. Thank you, President. With the development of the Northern Metropolis, there will be a great population surge in the population in New Territories North. The government must make planning for healthcare development in the area, but this is not a new development area. The Northern Metropolis comprises Yuen Long, Tin Shui Wai, as well as Kutong North and other NDAs, and also the University in Town and the Loop area. These are areas with a lot of talents. So in discussing the development of healthcare cluster, we cannot just look at the population estimation, but rather the change in demographics. In other words, who will live in the Northern Metropolis and what services will they need? Unlike older areas like Huangdai Xi and Sham Shui Po, we can foresee that the population in the new territories will be young. For example, newly married couples and young families. They will choose to move into the Northern Metropolis. They will also be employees in the companies in the Loop area. Unlike elderly patients, they may not require regular checkups, but rather they need medical services in terms of sport injuries as well as other services, including dental checkups and so on. Now, in catching up with the delay in medical services, we can make the Northern Metropolis a demonstration zone, which is planning-oriented. Now, the government plans to build a medical teaching and research hospital in Yaotan that will replace the hospital in Kutong North. Now, this hospital is worth the effort, but there should also be a family medicine center in the area to share the burden. For example, drastically increasing the outpatient quota places for sporadic diseases and also providing cross-disciplinary care for chronic diseases so as to divert patients from E&D services. Also, the center can also combine services including ophthalmology and other services to plug the gap. And also, healthcare facilities should be made part of the development plan in the Northern Metropolis. For example, there should be sites set aside for community pharmacies and community drug dispenser. At the same time, the hospital authority must redevelop existing hospitals in a timely manner and increase the number of beds to cater to the increasing need for medical services. So I urge the government to announce the second hospital development plan as soon as possible, and also implement the projects under the first hospital development plan. It is not sufficient to just rely on the public healthcare system. We must rely on the advantage of public-private collaboration in the Northern Metropolis. 2 sites have been set aside for private hospital development. We must use the Northern Metropolis to plug the service gap over the territory. There should be conditions to require the hospital operators to focus on certain areas and complement the innovation in life and health technology in the Loop area. And also, can we extend the Chinese medicine services to the Northern Metropolis? Now, the Prince Philip's Dental Clinic's service has been at the seam. So can we move the dental clinic to the Northern Metropolis to offer services to the general public rather than just taking extraordinary cases? Now, riding on this opportunity, the government should cast its eyes beyond the existing services provided by the hospital authority, but also primary health care, eye and dental services, and Chinese medicine services to bring together medical manpower in all disciplines to make the Northern Metropolis a medical healthcare demonstration zone. The experience should be exported to other districts in Hong Kong as a whole. Thank you. Mr. Yu Ming. Thank you, Deputy Chairman. The National 15th Five-Year Plan stipulates that we need to accelerate the development of the Northern Metropolis. In the first chapter of the consultation paper, the government has mentioned that the Northern Metropolis development is the most important topic. There will be tens of thousands flags yield in the area. There will be fast population growth. At the same time, society is concerned whether medical resources can be made available in time. Now, by 2031, there will be 1.1 million people in the New Territories North. The waiting time is the longest in Hong Kong, in the area. If we fail to add a new cluster as soon as possible, the burden on the 2 existing clusters in New Territories will be even heavier. So adding a New Territories North cluster will not only meet the actual need, it is also a strategic move for the Northern Metropolis development. Now, Mr. Holden CHOW proposed including the Tin Shui Wai Hospital and the North District Hospital in the cluster. and also coordinate the service coverage and resources of nearby hospitals clusters. I think this is a good suggestion. To add a new cluster, a lot of reorganization of resources is involved. Due consultation is called for. Now, with the population growth, we are facing a lot of pressure on the healthcare system. We should allocate more resources to the medical resources in the northern metropolis. For example, enhancing the doctor-to-population ratio and harnessing the power of the private sector. And also, the Kutong North sites can provide specialist outpatient services and primary healthcare services for the residents. This will help divert patients from the public healthcare system and provide more diversified choices for the patients. Now, besides the North District, the DAB has conducted a survey in Tin Shui Wai with 507 questionnaires issued. Now, the residents are neutral to the service performance of the Tin Shui Wai Hospital, and many of them think there is room for improvement. They hope that the location of the hospital and clinics can be nearer and that the waiting time can be shorter. Now, 40% of the patients would choose to cross to Tuen Mun Hospital for medical services, and some 30% of them would choose to receive private medical health care, while some people would cross to Shenzhen for medical checkup. More than 60% of Tin Shui Wai residents would have to cross to other districts for medical services. This shows that the public healthcare system in Tin Shui Wai is insufficient to meet the need of the grassroots. So besides accelerating the development of the Ngau Tam Hospital, we should also set a timetable for expanding the Tin Shui Wai Hospital, adding beds and adding specialist services. Now, in the survey, 60% of the respondents consider that there is a need to build a new private hospital. So in Hung Shui Kiu and in the Santee Tenopol's site, the government should attract operators to set up private hospitals on these two sites. Now, the planning and implementation of the New Territories North cluster will affect the well-being of hundreds of thousands of people in the northern metropolis. It is also closely related to the 5-year plan. There should be a clear roadmap and clear timetable to allocate resources and build a people-oriented New Territories North medical cluster. Thank you. Mr. Kenneth Lau, Deputy President, the population in the North District and Yuen Long has exceeded 1 million. Now, with the development of the northern metropolis, the population will grow even larger. There will be much more healthcare demand. Now, there are 2 clusters in new territories. The medical resources are insufficient. For some specialist disciplines, the waiting time is too long. For example, the psychiatric outpatient clinic, stable case waiting time is 74 weeks for the New Territories East cluster. Patients have to wait 1.5 years before they can see the doctor. So the government should set up a New Territories North cluster covering the North District and Yuen Long, and also integrate the medical resources in the area to shorten the waiting time and reduce the need for patients to cross to other districts. But there is a key demand for public health care services. For example, the Tin Shui Wai Hospital. It has a catchment size of 70,000 people. There are only 300 beds, and the utilization rate is 97%. Now, for complicated cases, they will have to be transferred to Pok Hoi Hospital or Tuen Mun Hospital. Residents have to cross to other district. Now, in the 2018 policy address, the government has included the Tin Shui Wai Hospital expansion project under the second hospital development plan with 800 more beds. However, with the changing population structure in Hong Kong as well as changing development conditions, the government has been reviewing the project. So far, the project has not started yet. Now, in the Hung Shui Kiu NDA, there will be some 226,000 people. Now, the additional population will add to the burden of the existing public healthcare system. With the population growth in new territories, North and West, the increase in medical resources is lagging behind. Now, the government should set a timetable for the expansion of Tin Shui Wai Hospital. And that should be a new territories north cluster to share the burden. The Hon TAM Main Hospital with 3,000 beds should be built as soon as possible. There should be a clear timetable for completing the Hong Kong Hospital to ensure that there is timely and quality medical services for the residents there. Now, the government should take a longer perspective to replan, to do a rethink on the medical resources in the New Territories North. The government should attract leading international medical organizations to set up hospitals in the area. The government should also harness the geographical advantages in Santiago and the Loop area to develop life and health technology industries and promote the commercialization and clinical use of research outcomes. With the building of the third medical school, there can be deeper collaboration between the three sectors. This will help build the Northern Metropolis into the medical hub in the Bay Area. Now, there are a lot of villages in Sha Tau Kok and Ta Gu Ling. All along, there are insufficient medical resources for the villagers. Many frail and elderly villagers cannot travel a long distance to the urban area for medical services. So there should be a better community healthcare network in the area, in particular, mobile clinics. Now, under the primary healthcare policy, the Hong Kong will launch a scheme of telemedicine services for villagers in remote areas. We will also deploy drones to dispatch drugs as well as diabetes testing papers. All in all, the government must be people-centric and take a long-term approach to implement the development of the New Territories North cluster. More resources should be given to New Territories North to ensure that there is high-quality services for the residents. I also submit I support the motion.
Mr. Aaron Bach. Deputy President. The Northern Metropolis is a new engine for growth of the city. It is 1/3 of the total area of Hong Kong. It is expected to accommodate 2.5 billion in population. As we see an aging population, we should see a greater elderly population in the New Territories North as well. And we expect by 2030, those aged 65 or above in North District and Yuen Long District will record new highs. We have several core challenges today in the northern part of the New Territories in terms of healthcare. With significant population intake, there is continuous increase in demand for healthcare services, but the supply cannot catch up. The median waiting time is the longest in the territory, especially for specialist services. We have the New Territories East and West clusters covering an expensive area. Many residents have to seek treatment and services across different districts. We do not have enough primary health care services, and we do not have outpatient services available during off-peak hours of adequate capacity. We also need to have more ancillary community health facilities. New Territories North does not have any private hospitals. If citizens have emergency, urgent private sector healthcare services demand, they have to go to Hong Kong Island or Kowloon for that. I support the HA to respond to developments of Northern Metropolis and to establish the New Territories North cluster in response to the demographic changes in New Territories North. We should also make sure to have comprehensive healthcare facilities, make sure we earmark sites for both public and private healthcare facilities to implement the second hospital development plan in an expedited manner. We should make good use of land in Northern Metropolis and in the vicinity to meet local and cross-boundary healthcare service demand. The original motion proposed making use of certain technopool and the loop and to develop life and health technology, and we should work in tandem with the development of the third medical school for that. I support this. The Ho Tam new development area has reserved 10 hectares in area for the construction of an integrated hospital, providing teaching, research facilities, and we can have it act in tandem with the Central Technopole to help facilitate development of the life and health technology industry. We should seize the opportunity of the establishment of the third medical school to have an integrated healthcare system that combines clinical services as well as biomedical research. I urged the government to work closely with the HKUST to make clear the operational model of the integrated hospital and make sure to facilitate sharing of resources among the 3 medical schools so that they can achieve complementary development in Northern Metropolis. We should also make good use of the flagship hospital in Ho Tam to rationalize their referral services in New Territories North. We should make sure to have proper distribution of research and clinical facilities to hasten knowledge transfer and clinical applications to provide more advanced treatment and services to New Territories North residents. Regarding what Mr. Ho-fung said about providing additional allowances for healthcare personnel working across districts, the BPA has reservations about this. We have other citizens of Hong Kong who have to work in districts where they do not live in, that they are not receiving allowances. So this is unfair and impractical. We should make sure to improve transportation infrastructure instead to facilitate commute. Deputy President, I speak in support of the original motion and Mr. Holden Chow's amendment. We will abstain from the voting of the amendment of Mr. Ho-fung. Thank you. Dr. Chen Hanpan. Deputy President, we have seen significant growth in the population of the Northern Metropolis. I believe as we are going to see a continuous increase in population, we should see an increase in demand for healthcare services in the area as well. There is some potential to tap into for the development of biotech in Hong Kong. As the Secretary said, the HKUST will establish the third medical school in Ho Tam and they will also establish a hospital. I have some observations about this. This hospital is very important for the development of biotech in Hong Kong. It can act as a pioneer. With the development of biomedicine in Hong Kong, it's not just about recruiting talent to Hong Kong and have companies set up operations in the Northern Metropolis. We need to anticipate what will happen in the Northern Metropolis. We want them to do clinical as well as advanced research. Apart from the companies setting up labs in the area, we need to make sure to provide facilities with research and development capabilities. It is very important to have a university that has both clinical and research capabilities, and HKUST is exactly that. I believe the HKUST has already commenced construction in the main campus. They will soon be admitting students. Upon admission of students, these trained individuals will not just be doctors, but doctors with research capabilities. I think the mission of doctors is not just about treating people. Unlike traditional stereotypes, I think doctors should also have spatial capabilities in scientific research. If we have the HA manage the hospital and it will provide 2,000 beds. It will just focus on providing services to patients. It cannot really play into its role as a research hospital. I think we need to have an integrated hospital, as the HKUST suggested, that combines biomedicine and R&D. How can we make sure, in terms of operational model, the hospital's operations will be facilitated? We do not have a good example in Hong Kong. We can perhaps refer to an example in Shanghai. The Shanghai University of Science is building its own clinical research and treatment facility. The university manages the hospital as well as an associated R&D institute. It can work with the industry for collaboration. If the hospital is led by the hospital authority, as the hospital authority's mission is to treat patients, while it is good, universities will be able to focus on other things. So I hope this medical school will be constructed well, but we need to make sure it develops well. We should give enough power to it for its operations. We can coordinate to play our different roles to create a development path for biotech in Hong Kong.
Does any other member wish to speak? Mr. Kasaf-Tam, you may now speak on the amendments. Deputy President, I thank Mr. Mark Chong and Mr. Holden CHOW for their amendments. Both of them are from the New Territories North constituencies. Now, I believe that they have received a lot of views from their constituents. The amendments show that they are concerned about the challenges that our healthcare network is going to face. The amendments call for better medical services and more resources for residents in the New Territories North, so as to prevent patients to miss out on the best treatment opportunities due to long waiting. Now, Mr. Mark Chong's amendment calls for providing extra allowances for healthcare personnel who work across districts, to attract them to work in the remote hospital cluster. Now, I believe this has aligned with my motion to make early planning for the North cluster. But there will be more and more demand for medical personnel with the completion of redevelopment plans of hospitals. Now, without early training and planning, even though we have the hardware, there will be insufficient medical personnel to man them. Now, for the Kai Tak Children's Hospital, its ENT department has been temporarily closed because of the absence of doctors. That shows the importance of early planning. But I believe that the concern over lack of manpower would only occur in the initial stage. And with the gradual population intake, as well as the commissioning of the third medical school, as well as the university town, there will be abundant medical talents for the New Territories North medical cluster. At the same time, as one of the key pillars in the Northern Metropolis, life and health technology can alleviate the burden on manpower. For example, smart medical healthcare, as well as telemedicine and AI-assisted diagnostic technologies. It can ensure that the medical personnel can focus their attention on the patients. In other words, we need to provide policy support in the short term to attract resources to the region. In the long run, we can establish a sustainable talent supply chain with medical innovation for the entire territory. Now, Mr. Holden CHOW's amendment proposed to include nearby hospital clusters in the New Territories North cluster. Now, there are worries that by including the Human Hospital into the New Territories North Cluster, it may be drawing away resources from the West Cluster. I agree that we have to be very prudent in reorganizing the clusters. That's a stronger reason for us to make planning earlier. Now, with the redevelopments of the projects, there will be more beds. However, the Hon TAM Hospital will only be commissioned by 2030. Bearing all these in mind, we have to make urgent planning for the New Territories North Cluster. With the rapidly aging and expanding population in the area, the system cannot cope. We have to establish the cluster as soon as possible and also form a cluster with the Tin Shui Hospital and Pok Hoi Hospital. I support the amendments made by the two members since they have faced the challenges straight on. So let's make our healthcare system more fair for the public. Now, the New Territories North Cluster is not just, it's about the whole territory. Thank you.
Secretary for Health. Deputy President, I would like to thank Mr. Tam Chun-kwok once again for proposing the motion, as well as Mr. Chong Ho-fung and Mr. Holden CHOW for proposing amendments. I would also like to thank the 18 members who have spoken on the motion today. The views and suggestions put forward by members fully demonstrate their concern for the healthcare system in New Territories North. Today's discussion covered a wide range of areas. Allow me to respond to only the main issues here. Regarding the specific arrangements for the establishment of the New Territories North Hospital Cluster, the Hospital Authority will fully align its efforts with the progress of hospital facility construction and development of the Northern Metropolis. When conditions are ripe, the cluster will be formally established. The service areas of the New Territories East and West clusters will be adjusted accordingly. The strategic arrangements are designed to ensure that the service populations of each cluster are maintained at an optimal and cost-effective scale of approximately 1 million to 1.5 million, thereby maximizing synergy and economies of scale. The two hospital development plans will add medical facilities in a timely manner in line with the development of the Northern Metropolis and the corresponding population growth. But I must emphasize that with the development of healthcare, it's not just about having equipment, infrastructure, personnel. We need to have in mind the demand. We want the paces to match. We have also commenced the planning work for the New Territories Clinical Services Plan. The HA will closely monitor changes in demographic structure and adjust the configuration of cluster services accordingly. The Clinical Services Plan will clearly define the roles of hospitals within each cluster to strengthen coordination between hospitals to ensure that the development of hospitals in each cluster is carefully planned and coordinated. When planning clinical services of varying complexity, the HA has consistently strived to ensure that patients receive the most appropriate healthcare services at appropriate times. For general and specialist services involving high utilization and low complexity, the HA aims to provide these locally in each district to facilitate routine consultations for the majority of patients, whereas specialist and critical care services requiring specialized clinical skills, qualified personnel, or complex equipment will be centralized at designated territory-wide or regional hospitals. For example, we have cardiovascular surgery. We have 3 designated hospitals providing such services. For organ transplant, we have a single hospital providing such services. We also have the Children's Hospital pooling resources of the HA to make sure we have a center of excellence for clinical services for children. The HA is also actively promoting daycare services and community care programs while strengthening collaboration with community partners. This enables patients to receive follow-up and rehabilitation care in their own district. This has maximized efficiency of healthcare resource allocation in Hong Kong. I also want to emphasize that there are differences between the Northern Metropolis and the New Territories North Cluster. The Northern Metropolis is a key development initiative of the SAR government. There are different projects, housing, livelihood projects. As for the New Territories North Cluster, is a hospital cluster we wish to establish on top of the New Territories East and West clusters. In a way, we will be cutting an area from the New Territories East and West clusters to form the New Territories North cluster. We will, when delineating the boundary, not only consider the facilities but also the population distribution. So we will have regard to the distribution of both population and healthcare facilities. I need to make clear when delineating boundaries, we will consider the population as well. So when a hospital is included in the new cluster, the part of the population served by the hospital will also be delineated in the new cluster. We will make sure to have a review of the service boundaries. We want to make sure to provide services to patients within the same district or close by, and each cluster should be of a reasonable scale. The cluster's hospitals should effectively provide integrated services to patients so that patients can receive continuous care in their cluster. We need to make sure there are adequate facilities in the area to provide integrated healthcare facilities and services. We will try to make reference to the boundaries of district councils. We will make use of government data to predict service demand as well to make sure the delineation of boundaries is justified. As for the suggestion put forward by Mr. Chong Ho-fung to consider providing additional allowances to healthcare staff working across districts, the HA already has a policy in place to provide allowances to staff performing specific duties. For example, for staff working in remote locations or staff working temporarily in remote areas or other districts, we have a special allowance for designated settings. We have, upon the establishment of the New Territories North Hospital Cluster, more likely than not, the transport infrastructure and transport network will be further enhanced. And in the Northern Metropolis, we have in mind the new accommodation may be quite popular among the younger healthcare personnel because they will look good, they will come at affordable prices. For accommodation in new development areas, generally, they would come at more affordable prices. So for healthcare personnel considering where to work, they will look at the services development of the hospitals and they will consider moving into the district if they work for a particular hospital in the Northern Metropolis. For those who are currently living on Hong Kong Island, I believe there is incentive for them to move to the Northern Metropolis to work there. As for the third medical school, it would accommodate the long-term manpower needs in healthcare for the city. It is also going to be beneficial for the development of Hong Kong as an international medical innovation hub. In Ao Tam May, we are going to have an integrated hospital, as said earlier. As you may understand, the two existing medical schools already have integrated hospitals that are doing very well. That is the Queen Mary Hospital as well as the Prince of Wales Hospital. With the establishment of the third medical school, more likely than not, and we have great expectations to have another integrated hospital on par with the high standards of the Queen Mary Hospital and Prince of Wales Hospital. We also have great expectations on teaching and research capabilities on top of the medical school's clinical capabilities. With the integrated hospital in Tam May, we will practice advanced planning, and this is more important than ever because we need to make sure the teaching hospital can work in tandem with the medical school to facilitate efficient transfer of research outcomes. So compared to the two existing integrated hospitals, we want to make sure the plans are perfect. For private healthcare participation, Sentinel Pool is a flagship project of the Northern Metropolis, and we are attaching great importance to development of it. We have already reserved land for healthcare facilities in the area. The Health Bureau will make sure to have good communication with stakeholders in considering which operational model to adopt. Perhaps we'll have a private sector institution providing healthcare services for citizens. But we also note in the private sector, there is a different operational model, and we need to have in mind the patient's patterns for seeking services in the private sector. Most private sectors are to the south of Lion Rock, and most private healthcare practitioners, especially specialist doctors, are south of Lion Rock or even mainly on Hong Kong Island. There are many factors to consider in terms of facilities and where practitioners are located. When we consider whether to construct a private hospital in the new territories, we need to have in mind what the potential market response is going to be, whether there are organizations willing to operate the hospital. And I think we really need to learn from the experience of the CUHK Medical Center. In terms of development of primary healthcare, to promote a community-based healthcare model centered on family doctors, the Primary Healthcare Commission will continue to deepen the development of the district health center network and strengthen the provision of primary healthcare services in New Territories North. As I said earlier, in the North District, we have over 300 service points provided by private sector family doctors. With the increase in population, we believe there will be more private sector practitioners providing their services in the Northern Metropolis in future. The private sector provides a majority of the services in terms of primary health care services. We have 75 family medicine clinics accommodating 5 million attendances, and the private sector provides 20 million accommodates for 20 million attendances, so they still are the majority. We will try to enhance capabilities of family medicine clinics, however, especially during evenings as well as public holidays. So, starting from Q2 of this year, we will gradually increase the number of evening clinic slots by 25,000, including in areas of New Territories North, such as the North District. In terms of medical innovation, I already talked about the GBA International Clinical Trial Institute. We have it being a benchmark along with the International Clinical Trial Center. And according to a document promulgated by the country in August 2023 for the development plans of the loop, the country emphasized the importance of the coordinated development of one zone, two parks. Shenzhen and Hong Kong should work together to develop the loop. And we are to expedite the pilot production and transformation of biomedical research outcomes. And the International Clinical Institute and the International Clinical Trial Center work towards this to promote clinical research and help develop an industrial chain. We also have other policies demonstrating the support of Hong Kong by the country, as well as cross-boundary facilitation measures, helping to develop the loop to be a pioneer in biomedicine, and that can also benefit patients. The Institute will continue to deepen cooperation with different R&D institutes in Shenzhen, as well as healthcare institutions, to really leverage on its role as a platform to accelerate the research, development, and commercialization of drugs, medical devices, and technologies to benefit patients, as well as drive the high-quality development of the biopharma industry. The Institute is actively preparing for the establishment of the International Clinical Trial Academy scheduled for 2027 to build a talent pipeline and organize international summits to cultivate more clinical trial specialists for Hong Kong. This complements the establishment of the third medical school and will consolidate Hong Kong's status as a hub for medical education and innovation. The loop and the neighboring Sandton Temple in future will form a more comprehensive medical research ecosystem, becoming a core hub for innovation-driven medical technology. For residents of New Territories North, as it borders the mainland, traveling north for medical treatment is increasingly common now. The HKSAR government will act in accordance with the principle of fostering the development of healthcare systems in both the mainland and Hong Kong, and hence cooperation with other cities on the mainland. Before, we already promulgated policies to provide convenience to citizens, specifically residents living in the mainland. We have the Elderly Health Care Voucher GBA pilot scheme, cross-boundary health record sharing, as well as a pilot scheme for direct cross-boundary ambulance transfer in the GBA. These all facilitated patients in the North District in particular to have different options in healthcare. Lastly, I would like to express my sincere gratitude to members for their concern and for their valuable views. The SAR government will continue to build consensus and further review the planning of service provision within the hospital clusters to ensure that the long-term allocation of public healthcare resources keeps pace with development needs of the Northern Metropolis. We will also make good use of the development opportunities brought about by the development of the Northern Metropolis. Thank you, President.
I now call upon Mr. Mark Chong to move an amendment. Deputy President, I move my amendment. I propose the question to you that the amendment moved by Mr. Mark Chong be passed. I now put the question to you as stated. Will members please proceed to a vote? Please press the present button. With those in favor, please raise their hands. Mr. Holden shall claim a division. The division bell will ring for 5 minutes.
Priscilla 係咁㗎，淨係咁規程嗰隻手㗎咋。係啊。我呢個讀慣呢啲就，但係佢嗰個選舉委員會嗰個就係有啲唔同嘅。Cindy 嗰個投票嗰個顯示呢度，呢邊啊嘛。
Voting begins. Please press the presence button and then cast your vote. Please check your vote. There are still members who have yet to press the button. Mr. Aaron Bok, please press the button. Mr. Chen Pok-chi. If there are no questions, voting is closed. Please show the result. Election Committee, 38 present, 6 for, 2 against, 30 abstention. Functional constituencies and geographical constituencies, 47 present, 9 for, 0 against, 37 abstention. As the question is not agreed by a majority of each of the two groups of members present, I declare the amendment negative. Mr. Holden Chow, please move your amendment. Deputy President, I move my amendment. I propose the question to you that the amendment moved by Mr. Holden Chow be passed. I now put the question to you as stated. Will members please proceed to vote? Please press the present button. With those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present, that is, those returned by the election committee and those returned by functional constituencies and geographical constituencies. I declare the amendment passed. Mr. Tam, you still have 3 minutes and 5 seconds to reply, then the debate will come to a close. Mr. Tam. Deputy President, I thank 70 members for speaking in my motion debate concerning developing the New Territories North medical healthcare system. A lot of invaluable views have been put forward. Now, I thank the Secretary for confirming that the government is enhancing the New Territories North medical capacity through different measures. But I emphasize that we really need a New Territories North hospital cluster to meet the surging needs. I know it takes a lot of resources and time, but medical health care is the basic safety net for the residents. With the development of the Northern Metropolis, there will be a much larger population in the New Territories North. The existing resources level is insufficient. Now, the Secretary mentioned in his opening remark that there are more and more conditions for developing the New Territories North cluster. When the population has reached 1 to 1.5 million population, the cluster will be developed. But that will be too late. We will be playing catch-up. I urge the government to implement the cluster as soon as possible and speed up the development of the Hong Kong and Ho Tam Hospital, as well as the private hospital in the Northern Metropolis. Also, the medical resources in the area should be coordinated to provide timely medical care for the residents. The cluster can also create synergy with the development of the third medical school, nurturing talents while delivering medical services. I urge the government to consider our views and make plans to implement the New Territories North cluster as soon as possible. I so submit. I now put the question to you that the motion moved by Mr. Tam as amended by Mr. Holden and CHOW be passed. Please proceed to vote. Members, please press the present button. With those in favor, please raise their hands. Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present, that is, those returned by the election committee and those returned by functional constituencies and geographical constituencies. I declare the motion as amended passed.
無立法